Hi, I'm Dr. Bonds, as you know, and I wanted to share with you some information about myopia. As always, I have some free time. I had a couple of patients, husband and wife, very cute little couple. One needed to cancel, and then the other one wanted to cancel too because they only do things together. So I have some free time, so I want to share information about myopia. This is what I do. This is what my passion is. So today's topic is axial length. So as you guys may know, myopia is a problem with vision being blurred at a distance, but very clear up close. It's something that's super common, especially nowadays. More and more kids are becoming myopic all the time. More and more kids needing glasses. A lot of that has to do with screen time and that sort of thing, which we'll touch on in another video. Today's purpose is axial length. So you might wonder, okay, what's axial length? Or I've heard of this, or maybe I read about this when I was doing my own research on myopia. So I wanted to go over it with you. Axial length is essentially sort of like the diameter of the eye, or the length of the eye. So we can measure by using something called optical biometry. We can measure the distance from the front of the eye to the back of the eye. So I have this great eye model. I'm going to grab it right here. And so this is a normal, healthy eye right here, right? And you can see it's kind of like a globe or a sphere. The axial length is actually the distance from the front all the way to the back. So we have this kind of distance from here to here. It's how long the eye is. And what we know is that with myopia, this eye lengthens. It gets longer and longer, and it does so at a rate that is abnormal. So a lot of young people who maybe need their first pair of glasses because they can't see the board at school, they have this blurriness, and for most of them, it's because the axial length is too long. The distance from the front to the back of the eye has grown too long. And with most of our kids, it doesn't just stop right there with the first pair of glasses, right? So we kind of arrive at this point where we're finding out that our child has nearsightedness or myopia, and axial length should be measured at that point, because then we know, is it because the eye is abnormally becoming too long, right? That's a kind of myopia that we have treatments that we can use to slow down the myopia progression or slow down this axial length. So this axial length is known to get bigger and bigger as we get older through the years, right? So if we have a young person, like a son or a daughter, who maybe has needing their first pair of glasses, and we can measure their axial length, and then we can measure it at certain time periods to see if the axial length is growing too fast. We know that kids, normal kids, we're expecting normal growth. Of course they're growing, right? So we're expecting this axial length to get longer, but within a normal, at a normal rate, right? So we know that axial length should increase for young children between 0.1 and 0.2 millimeters per year. If we see that the axial length is growing in addition to what we're expecting, then we also know that the myopia or nearsightedness is likely going to get worse, right? And most of us, if we've ever had myopia or glasses, like I have, we were just kind of used to getting stronger glasses, 1 year to the next. No one really knew at the time, or at least they didn't know that maybe there could have been interventions. But the fact that the axial length is continuing to grow at a rate that it far exceeds what it should. Now, normal axial length for adults who don't need any glasses, maybe they never needed any glasses, normal axial length is about 23.5 millimeters, maybe pushing up to 24, okay? So somewhere in that range, that is considered to be normal axial length, 23.5, right? As myopia starts progressing and the axial length is growing at a fast rate, that axial length is going to be longer than what it should be. And many of the kids who come to my practice actually have axial lengths that are adult size already, even though he or she is a young person, right? When axial length pushes up past 25 and approaches 26 millimeters, that is actually quite a large eye. And actually, high prescriptions actually can go higher than 26. The patient in my practice that has the highest axial length is an adult, and it's almost 30. And that's really, really long. So it's a very long eyeball. And what are we concerned about with a long eyeball or a long axial length? Like what's the big deal, right? That's what everybody would want to know. What's the big deal, right? I can just get LASIK and that will fix it. Well, let's talk about LASIK just for a second. LASIK is a surgical laser procedure that affects or is applied to the cornea, which is just this spot right here, right? And that can correct vision as long as your prescription is not too high, right? So someone can get LASIK and they can see better without the need for glasses or contact lenses, but it doesn't change the fact that the axial length is too long, right? So what's the big deal about that, you might ask, right? Like, why do we care, right? Well, it turns out that an axial length that's too long means that this eye has stretched, okay? And it has stretched beyond what is normal, okay? And that means that the structures and the anatomy of the eye can become weak. And the higher the axial length goes, the more weakening of eye structures we get. So, people who have high myopia, most of the time, have a high axial length, a stretched eye. And that means they're at risk as an adult for eye-related issues that are directly related to having a long axial length. Those include cataracts at a young age, glaucoma at a young age, myopic macular degeneration, and retinal detachments. We know that people with high axial lengths or a lot of myopia are all at risk for these things. In fact, that patient I was telling you about, the one with the high axial length, he is only in his mid-40s and he already has myopic macular degeneration. His vision is already suffering and he's only in his mid-40s. Now, the next question I get most of the time is like, is there any way to reverse this? Is there any way to reduce axial length once it's gotten so long? And unfortunately, at this point, there's no way to reverse it. Axial length, once your eye grows to a certain size, we'll call it, we cannot shrink the eye down. So we can't shrink it back to a normal axial length. The key is to introduce early preventative treatment so the axial length doesn't get so long in the first place. So it's highly, highly imperative that we look at our nearsighted kids, our kids who have myopia, especially the ones that get myopia at a young age, and we look at all of the things we can do to prevent this axial length from becoming longer and longer and longer at a rate that is out of control until they get to be an adult with a long axial length, a high prescription, can't get LASIK because it's too high, and they're at risk for all of these eye problems because of the high prescription and the axial length being too long. So we must try to introduce preventative type treatments to slow axial length growth. And this is what I've been devoting my extra time to over the last several years. It's what I love to do the most, help the kids in the practice. I'm a mom myself, so I couldn't think of anything better than someone out there trying to help my kid, and so that's why I do it. We can definitely talk about treatments that are aimed at slowing axial length growth, therefore keeping our kids' eyes healthy, preventing deterioration, and reducing risk of serious eye issues that can arise from this axial length problem. So I hope that you learned a lot about axial length today. I'm certainly going to share more and more and more about myopia and all the caveats, all the different kinds of things that you can learn about with myopia. And we'll do some fun things over time. So thanks for joining me, and I hope you learned a lot. Do your own research. Make sure you're with an eye doctor who really cares and who can really take care of this stuff for you and your kids. Thanks.